Thank you, Mr. Speaker. Mr. Speaker, since April, the Alberta Medical Association, along with Alberta physicians, have been monitoring negotiations with this government before their current 8-year agreement expires in March. The Premier spent her leadership campaign talking about the importance of consulting with Albertans. But recent reports show that the negotiations between the government and the AMA have stalled, leaving funding for our physicians and our healthcare system up in the air. This government needs to get to work and commit to getting back to the negotiation tables with the AMA so as to settle on a contract before the next election. This government also needs to listen to the concerns of the AMA and place a renewed emphasis on primary care networks. The Wild Rose believes that primary care networks are the next important step in fixing the healthcare system. PCNs do a superior job of treating patients with chronic conditions like diabetes. They also offer services like dietitians advice, physical therapy, or a host of other healthcare services in a seamless way. Studies show that the PCNs divert patients from our overcrowded emergency rooms and hospital wards. But conversations on PCNs and how to improve healthcare in our province will not take place if the government continues to brush aside the concerns of physician intimidation as mere workplace disagreements. With the culture and bullying prevalent in our healthcare system, it simply isn't right for the government to hold these negotiations over the heads of our healthcare workers and the AMA. It's time for the Health Minister to understand that this isn't a workplace issue. It's a management issue stemming from the government level. It's no longer possible for the healthcare professionals in this province who hold the entire system together to trust this government. It's time for this Premier to finally fulfill at least one of her promises and call a full, judicial, independent public inquiry so Albertans have the answers before the next election.